Hi, I am Joao Horvat, and I'm here to present our study published in the Journal of Magnetic Resonance Imaging entitled Diffusion-weighted imaging with apparent diffusion coefficient mapping as a quantitative imaging biomarker for prediction of immunohistochemical receptor status, proliferation rate, and molecular subtypes of breast cancer. This study was conducted at Memorial Sloan Kettering Cancer Center in New York in conjunction with the Medical University of Vienna. Multiparametric features of magnetic resonance imaging were developed to increase the specificity and to improve breast cancer diagnosis. Diffusion-weighted imaging is one of the most often used MRI parameter in a multiparametric setting for breast cancer diagnosis. Diffusion-weighted imaging with apparent diffusion coefficient mapping provides information on tissue microstructure and cellularity that can be used for lesion characterization. The presence of estrogen receptor, progesterone receptor, human epidermal growth factor receptor 2, and proliferation rate are major prognostic factors of breast cancer, which are used for guiding therapy decisions. Receptor status is related to tumor cellularity, vascularity, aggressiveness, and sensitivity to neoadjuvant treatment. Diffusion-weighted imaging with apparent diffusion coefficient mapping has been proposed as a quantitative imaging biomarker for determination of prognostic factors. High proliferating tumors with increased cellularity are expected to have lower ADC values, whereas tumors with increased neovascularity with greater vascular permeability are expected to have higher ADC values. So the objective of our study was to evaluate whether different ADC measurement approaches and metrics can be used for prediction of receptor status, proliferation rate, and tumor molecular subtypes in patients with invasive breast cancer. In this Institutional Review Board approved retrospective study, a prospectively populated database which consisted of 524 patients who underwent state-of-the-art magnetic resonance imaging with diffusion-weighted imaging between December 2010 and February 2014 was queried for individuals with invasive breast cancer. The exclusion criteria were non-mass enhancement or multiple masses, types of cancer other than invasive ductal carcinoma or invasive lobular carcinoma, poor image quality or lesion non-visibility on diffusion-weighted imaging. Patient selection is here demonstrated. The final study population consisted of 107 patients. 2 breast radiologists with 7 and 12 years of experience independently identified the image with the largest tumor diameter on high B-value images. Then, 2 two-dimensional regions of interest were drawn, one on the whole tumor and another one on the darkest part of the tumor. Here is a case example of the 2 ROIs drawn on the whole tumor and on the darkest part. The minimum, mean, and maximum ADC values were obtained from the two measurement approaches. Statistical analysis was performed on the apparent diffusion coefficient values obtained from the whole tumor and from the darkest part, according to receptor status, proliferation rate, and molecular subtypes of breast cancer. Concordance correlation coefficients were calculated with the values obtained by the two readers. Estrogen receptor status was significantly different for both readers on mean and maximum whole tumor measurements. Progesterone receptor status was significantly different for both readers only on maximum whole tumor measurement. None of the metrics used were significantly different for both readers according to HER2 or Ki67 status. In these tables, we demonstrate that significantly lower ADC values were observed on ER-positive tumors using maximum and mean whole tumor metrics, and significantly lower ADC values were observed on PR-positive tumors using maximum whole tumor metric for both readers. The maximum whole tumor apparent diffusion coefficient was the only metric that was significantly different among molecular subtypes for both readers and was able to differentiate luminal from non-luminal cancers with moderate accuracy. The concordance correlation coefficients of the ADC values between the two readers were moderate for mean and maximum whole tumor, and low for the other metrics. Here we can visualize how the mean and maximum whole tumor had better concordance than other metrics. In conclusion, maximum whole tumor ADC was found to be a valuable quantitative imaging biomarker that may be used to predict hormone receptor status and molecular subtypes of breast cancer. Future technology improvements may increase the accuracy of diffusion-weighted imaging with apparent diffusion coefficient mapping so it can have clinical applicability. Thank you for your attention.